Okay, so let's go ahead and get started with your foot exam. I'm going to start by doing just a visual inspection. I want to get an idea for the overall integrity of your skin, make sure I'm not seeing any signs of skin breakdown or any sort of diabetic ulcers or anything like that. So just having a look at your calves. Do you see just a little bit of scarring on this leg? Nothing that seems overtly abnormal. You have a couple tattoos. It does look like they've healed normally. I don't see any excess in scar tissue or anything like that. Having a look at the other leg again, it does look like you have a little bit of scarring. It appears to be from some type of surgery on your ankle. Scarring appears to have healed normally. Do you have any issues with this area as far as pain or tenderness? Okay, good. So not noting any abnormalities with that. Just having a look at the other side. Skin appears healthy overall. Appear to be well hydrated. I'm not noticing any signs of dehydration. It does appear that you have a cat. I see a little bit of cat hair, which is totally fine. And hair growth appears to be normal. I'm not noticing any areas that are sparse or any signs of diabetic alopecia, which can be hair loss on the lower extremities due to diabetes. Okay, I'm going to go ahead and have a look at your nail beds. It does appear that you have on false nails, which is totally fine. They appear to be removable, which is your best option, so they cause less damage to the integrity of your nails. So in the case of patients who have false nails, we're obviously unable to check the capillary refill on the nail itself, so what I'll do is just put a slight amount of pressure on the top of your foot, and that'll kind of help me get a gauge of normal blood refill, and I am seeing a normal response, less than 2 seconds. Again, normal blood response of less than 2 seconds, so that's perfectly fine. I'm going to go ahead and have a look at the bottom of your foot, just having a look at the skin overall. I will be having you turn over in a second, but for now I just want to get a little look, and so far everything appears normal there. Okay. Let's go ahead and move on to do just a couple of measurements. I just want to compare the size of one foot to the other. So I'm going to be measuring this ankle. So I will lift your ankle slightly here, and okay. Do that on the other side. About 10 inches. Let's have a look kind of medially. 9 inches there. And again, 9 inches there. Does it appear that you have a slightly raised vein here, but I'm not suspecting any signs of varicose vein or any abnormalities in blood flow there, so that's fine. Good. Very good. Okay. So far, not noticing any signs of asymmetry. Okay. So about 18 on both sides there, which is perfectly fine. Why don't we go ahead and move on? I am going to do just a couple temperature checks. I want to make sure that we're having even circulation and that there's not any loss of blood flow in your lower extremities. So just having a feel for the area. Lower extremities do appear warm and even throughout. You're slightly colder up towards the calf, warmer down by the foot, which is a good sign. I'm not noticing any loss in temperature as we go down towards the toes. I'm going to go ahead and check her pulse. Pulses appear to be equal. Not noticing any signs of abnormality there, which is very good. You see a small freckle here, appears to be normal in size and color. Okay, so let's go ahead and begin with a sensation exam. I want to make sure that you're not having any issues with lack of sensation or any signs or symptoms of neuropathy. So I'm going to start by using something fairly soft. So I just have 2 cotton wisps here, and I'll be swiping these along both of your legs just like this. And I want you to just tell me if you can feel it. You can just shake your head. You don't have to say anything if you don't want to. So, can you feel that? Okay, perfect. And that feels soft to you? Perfect. Feel that there? And there. Good. And this should feel soft all throughout. Good. Soft all here. Very good. So I'm going to flip these over and you're going to feel something slightly sharper. So it should feel like this. And I just want you to tell me if you feel sharp every time I touch you. Good. Sharp here and here. And no loss of sensation along this scarring, correct? Okay, good. So I'm just going to do that along your toes. Make sure we're not losing any, there we go, not losing any sensation there. Very good, okay. So I'm going to try that with something a little different. I have a rounder tool here. Essentially, I'm going to be doing the same thing. I want you to just shake your head yes when you feel it. Good job. Very good. the next thing I'm going to do to test the sensation on the top of your feet is use my little pinwheel here. So this is pretty sharp, but it's not going to puncture your skin. It's just going to feel a little more obvious than the last few tests. So what I'm going to do with this one is roll it down the length of your leg. I want you to just tell me if it feels any less noticeable as I go down. So essentially this is testing for any loss of sensation as we move towards your toes, which would indicate a sign of acute polyneuropathy. Not something I'm suspecting in this case, but it's always better to be safe than sorry. I know this is kind of ticklish, so I apologize. And no loss of sensation with any of this, correct? It feels the same all the way down. Very good. This side should feel the same all the way down. And it should feel the same here. And again, no loss of sensation across that scarring. Making sure to test across the toes. Very good. Okay. I'm going to go ahead and do some temperature testing. So I have a tuning fork here, but I'm going to be using this to test whether or not you can feel something cold. So if I touch this to your skin, it should feel very cold. I want you to just shake your head if you can feel that it's cold. If it starts to feel any less cold, be sure to let me know. So it should feel cold all the way down here. Same thing on this side. Should feel the same coldness throughout your leg. And comparatively, this leg should feel the same coldness as this leg, and you're not noticing any differences there, correct? Okay, perfect. And then no loss of sensation around your tattoos, which is great. Okay, very good. So the last thing I want to do for the tops of your feet is just to do a little bit of bone tapping. So just testing the integrity of your bone structure by very, very gently tapping these areas. It shouldn't cause you any pain, but might be a slight reaction. Very good. Not noticing anything abnormal there. Just going to be doing the same thing along your ankle. Not noticing any signs of swelling, edema, or injury to the ankle area. And bone structure seems to be healthy. Definitely not seeing any signs of calcium deficiency or osteoporosis. And you do have muscle here that I'm just testing the reflex. Good. Testing the reflexes in the joints between your toes, and I am getting a normal reaction. Okay. So lastly, just look at the joint here. This bone provides structure to your foot and allows you to remain stable while you're walking. So it's definitely important that we test bone structure here, but everything with that looks okay. Let's go ahead and have a look at the other foot. Taking a look at the bones on the inner side of your ankle. Do you have any issues with rigidity or lack of mobility after your surgery in this leg? Okay, perfect. Very good. So I'm just going to have a look at your ankle. Again, not noticing any signs or symptoms of swelling or injury on this side, which is good. You are fairly active, so it's a good idea that we check for injury, but doesn't appear to be anything abnormal today. And again, just testing that muscle structure here. Very good. Very good. Getting a normal reaction there. So you have a couple of veins that run down the length of your foot. You can test these by following them to the joint and then doing a slight tapping motion. And I am getting a normal reaction there. Lastly, let's go ahead and have a look at that joint here, and I'm getting a normal reaction here. Okay. So the good news is that I'm not seeing any abnormalities at the top of your foot. Everything appears to be normal. I'm not noticing any deficiencies in your bone structure. There's no signs of injury. Your skin integrity looks good. Your nails, from what I can tell, look healthy. The artificial nails don't appear to be a risk of infection to me. It looks like you take care of them well. As long as you're switching them out, I would say at least once a month. Make sure you give your toenails like a day or two to rest in between application. You should be totally fine. The nails that I can see appear to be healthy. I'm not seeing any lack of integrity in the nail structure itself. Cuticles appear to be well nourished. No signs of excess dryness. There's definitely not any signs of fungal infection. So all of that looks fine. You do have normal capillary refill, so I'm not worried about any signs or symptoms of blood loss or lack of circulation. Your feet overall appear to be healthy looking. Your hair growth appears to be normal. There's no abnormalities with that. So I do want to go ahead and test the bottom portion of your foot at this time. So I apologize if you're ticklish. This might tickle just a little bit. I will try to be careful. So I'm going to go ahead and have you turn over onto your stomach with your feet plantar facing me, and we'll have a look from there, okay? Okay, so let's go ahead and have a look at the plantar side of your feet. So just having a look overall with my Penlight. Again, looking at the lower leg on both sides. Skin appears to be normal and healthy looking. Skin color is normal for ethnicity. I'm not noticing any wrinkling or any sort of abnormalities that would point to rapid aging. I do see a few veins here, but you are pale in tone, so that is to be expected. Again, no signs of varicose or spider veins, so that's good. And normal coloring in those veins at all. I'm not seeing any signs of purpling or anything like that. I see a slight scar here that appears to be healing well. So I'm going to move down to the bottom of your feet. Do you see what looks like a slight abrasion here? Is this from a pair of shoes that you were wearing? Okay. So that is normal. Sometimes when we wear shoes that aren't structurally supportive, they can leave slight indentations or marks where they've been rubbing on our feet, so I'm not too worried about it. It does look like it's been healing. Just having a look at your heels. They do appear slightly dry, but nothing that I would say is acutely abnormal. Doesn't appear to be a dryness due to dehydration or anything like that, so that's fine. And you tend to wear shoes that are like sandals, correct? Pretty frequently, okay. So that is normal. People who tend to wear sandals more frequently, especially in the summertime, can tend to have drier feet just because your skin is exposed to the air. So that is totally fine. Just having a look at the bottom of your feet, I do see just a very slight mole here. A little bit of a closer look at that. It does appear to be normal. I'm not seeing any signs that it's raised. Very light in color. I'd be more concerned if it was dark. And it is symmetrically round. It doesn't have any undefined borders, so I'm not worried about that at all. And you have another one on this foot that appears to be totally normal. Not seeing any reason for concern there. And this wrinkling of your feet is actually a very good sign. So we have excess skin that helps pad our feet, and when you kind of scrunch your foot, you should see a wrinkling that indicates healthy blood flow and proper hydration. Any lack of wrinkling here could be a sign of poor kidney function or just overall imbalance of your electrolytes, but this appears very healthy. So having a look at the bottom of your toes. Very good. You have a very prominent fingerprint, or toe print as it were. And again, just checking for proper blood return. And skin appears blanchable. Less than 1 second of return here, which is a healthy indicator. Very good, okay. So I'm going to do something similar on your heel, and just checking to make sure that the skin is blanchable. Essentially what that means is I'm just pushing down to occlude blood flow. Skin should appear white in color, and then upon release, pink color should return within 1 to 3 seconds. For your age, I would expect a 1 second return, which is what I'm seeing, which is good. does appear to be slightly more wear on this side. Is this your dominant side? Okay, so that makes sense. People tend to lean more onto their dominant handed side, so it does make sense that this heel would have a little more wear and tear than this side. Okay. Just again checking for that normal temperature range. Calves do appear to be slightly cooler than your feet, which is what we want to see. Very good. So skin, turgor, and elasticity appears to be normal. Just performing a slight pinch of the skin helps me gauge for any lack of elasticity or abnormalities. I'm not noticing anything. Very good. So I'm just going to perform a slight stretching of your skin here. Very good, okay. So not noticing anything here. Skin appears very healthy and well taken care of. Okay, so let's go ahead and move on. I do want to just do a quick measurement here. Just checking for any signs of asymmetry. Okay, very good. So let's go ahead and move on to a couple palpations and percussions. Again, just checking for proper integrity in the muscles of the bottom of your feet. So looking for anything that could indicate muscle atrophy or weakness or any wasting of the muscles. Anything that would indicate an abnormality. Maybe your shoes aren't fitting you correctly. These are just all things that we look for. But not noticing anything. I do want to go ahead and do a sensation test on the bottom of your feet. So I will be careful. I know you are ticklish, but it is important that we test this, especially to rule out any signs or symptoms of diabetes. So far, I'm not suspecting that, but I do want to make sure that we are thorough in our exam. So again, you're going to feel 2 very light cotton wisps. I want you to just shake your head yes when you feel this, okay? Good. It should feel the same all the way down. Let me know if it doesn't. So are you feeling it any less on one heel compared to the other? Okay, good. And then of course we want to check along the toes. And And lastly, we're going to go down the middle of the foot, and this part tends to be ticklish. Perfect, okay. So I'm going to switch these and go on to the sharper side. So now you should feel two sharp points on the bottom of your feet. Just let me know if you don't feel it or if it feels any different from one side to the other. Okay. Normal reaction across the toes. Go parallel to the toes. I do want to check for vertical sensation here. Any difference here? Good. Then we'll do very good. Okay. So let's go ahead and move on to a different portion of the sensation test. I have a very small brush here. It's kind of hard and plasticky, but it should feel relatively soft to the touch. Can you feel this okay? Perfect. Just going to feel me swiping this on the bottom of your foot. Just checking for any signs of abnormal reaction. Let me know if you feel any differences here. Any difference along the toes. Okay. So just having a look on this foot. Checking for any signs of abnormal reaction, but I'm not seeing anything. All of this appears to be normal. Okay, very good. So, the next thing I want to do as far as testing your sensation is I'm going to go back to this sharp roller, and of course I will be careful, but it should feel slightly less noticeable on the bottom of your foot than it did on the top, just because of course you naturally have built up callus and the skin on the bottom of your foot is thicker than that of the top. So mostly just testing for skin integrity. Make sure your feet are being properly protected. So let me know if any of this is less sensitive or painful. I know it's probably very ticklish. Along the toes. Okay. Let's go ahead and check the other side. The activity of your toes, and I'm not seeing any abnormalities there. So I'm going to do a little bit of that cold sensation testing, so just let me know if this feels any differently than this, or here versus here, or here versus here, or here versus here. Not noticing any abnormalities in the reactivity of your feet. Does this coldness feel the same as this coldness here? Okay. Any difference in the coldness here versus here? Perfect. And no difference here versus here, correct? Okay. Does this feel the same coldness on all of your toes? Okay. And then here and here should feel the same. Okay. And then I just want to do one little test. You can feel that vibration. Okay. And here as well. Very good. And here as well as here. Lastly, here should feel the same as here. Okay. Very good. So no signs or symptoms of abnormalities there. And a little bit of a different tool here. For this one, you don't have to tell me if you can feel them, just get a sense of the overall integrity of your skin. Not noticing anything abnormal there. So the last thing I'm going to do is just make sure you get normal reactivity in the muscles of your feet. All of that appears normal. So the last thing I'm going to do here is lift your foot, and I want you to just totally relax the weight of your leg in my hand And I'm going to be testing your Babinski Reflex. Essentially, that means I'm going to be swiping a cold metal object along your foot, and we're looking for movement that would indicate a normal reaction. Any lack of movement could be a sign of a neurological deficit, so that would indicate a positive Babinski reflex. So I'm going to go ahead and start. Just relax your leg for me and let it move freely as it would. Very good. I'm going to do that one more time. Very good. Okay, so negative reaction. I'll have you relax that leg. Let's go ahead and do the other side. And same thing, just relax the weight of your leg in my hand and allow it to move freely. Okay. Just relax that leg for me. Very good, okay. A little bit less of a reaction on this side, but nothing that I would say indicates any sort of neurological dysfunction. And as I kind of force a reaction here, I am getting movement in your toes, which indicates a negative response to Babinski, so that's very good. Okay. Alrighty, well the good news is I am not noticing anything that I would say is of note. There's no signs or symptoms of diabetes or any abnormalities that would indicate you're wearing the wrong size shoe. You do have this slight indentation of your heel here, but it is summertime and you've been wearing open-toed shoes, so that is normal as long as it's healing properly. It doesn't appear to be any sort of diabetic ulcer, which is good. Toenails appear healthy. Overall, I would say you could maybe use a thicker cream on your feet, especially when you go to sleep at night. If you apply a petroleum-based product such as Vaseline or Aquaphor, and then maybe sleep with a pair of socks on, that will alleviate some of this dryness, but it is very cosmetic. There's nothing, penetrating deeper layers into your skin that I'm concerned about. So as far as I'm concerned, you have a clean bill of health on my front. So if you have any questions, you can let me know, but if not, you are free to go, and I appreciate you for coming in today. Thank you.